Hello and welcome to Heartland Health Center's From the Heart virtual gala. My name is Jisoo Ki from WGN America's NewsNationNow.com. I hope you'll download the app. I'm so honored to be here tonight as your host. Heartland Health Centers is an organization I hold close to my heart. I came here as a child from South Korea, and I know firsthand how important it is to connect to needed services, particularly healthcare services for immigrants, refugees, and anyone who struggles to afford healthcare. Heartland Health Centers provides a welcoming, affordable, and accessible healthcare home for close to 30,000 patients annually across 17 sites. Now, 7 of those sites are school-based health clinics, including 3 elementary schools. Although we can't be together in person, it's important to recognize and celebrate the accomplishments of Heartland Health Centers over the past year. The COVID-19 crisis has highlighted many inequities in our society. It's also shown us that federally qualified health centers like Heartland Health Centers are incredibly critical to keep our communities strong and healthy. So tonight, if you're able, I hope you'll be inspired to donate and ensure Heartland Health Center's ability to provide holistic, comprehensive health care for all can continue. Now, I would like to introduce my co-host, Heartland Health Center's Governing Board Chair, Philip Dothard, and Development Board Chair, Matt Katzfei.
Thanks, G. Good evening, everyone. My name is Philip Dothard, and I am the Chair of the Board of Directors of Heartland Health Centers.
And I'm Matt Katzfei, member of the Governing Board and Development Board Chair. Thank you all for being here tonight. We have a terrific program that will showcase the transformational work Heartland Health Centers does every day and how their staff rose to the challenge of providing high-quality, comprehensive healthcare in the pandemic. We also have some exciting entertainment provided by Jeff Tweedy of Wilco and the Chicago Children's Choir. So stay tuned, and please donate if you can. Every gift, regardless of size, makes a difference.
Earlier this year, we said goodbye to our CEO of 10 years, Gwen Rausch, when she retired in July. Later in the program, we will recognize Gwen's many achievements. But first, it's my distinct pleasure to introduce HHC's interim CEO, Nicole Willis.
Thank you, Philip, and good evening, everyone. My name is Nicole Willis, and I am honored to have been chosen to serve as interim CEO of Heartland Health Centers. At any time, it is a challenging endeavor to assume the top leadership position of a healthcare organization, but to do so during a pandemic has truly been daunting. That is why I am incredibly grateful to our dedicated, hardworking staff who have shown great strength, adaptability, grace, and skill throughout this extraordinary time. As you watch the program tonight, you will see that the entire team at Heartland Health Centers united behind the common purpose of providing continuity of care to our patients and to serving the community. COVID-19 forced us as an organization to be creative, adaptive, and responsive. Although none of us could see this coming, we learned that at Heartland Health Centers, we were ready. As you watch the program tonight, please consider making a donation of any amount. Your gift will go directly to support access of high-quality health care for those that need it most, and will ensure our ability to be ready for what is next. Thank you.
Thanks, Nicole. As you'll learn tonight, when the pandemic hit, the entire Heartland Health Center team pulled together to implement new ways to serve their patients. One demonstration of this is the creation of drive-through testing sites for patients at 3 of its locations. We have some footage from one of those locations at 1300 West Devon. Take a look.
There was a big group of us that were exclusively school-based Heartland staff, and the schools closed in March. We wanted to feel like we were being productive members of the Heartland team, so we jumped in and filled the need to develop and staff the drive-through locations. So we've got our biggest one here at Devon. We also have our Skokie drive-through and our Albany Park drive-through locations. We're also teaming up with different neighborhoods to do some community testing events.
Here's the process of what happens here at the drive-through testing. The patient will pull up, they're met by Deandra. She verifies their identification. She then lets me or Emily know who the patient is. That is communicated with the inside team. What's happening inside is there's a medical assistant who is going to execute the call and explain what the patient is going to be going through, what the test is like, what we're going to ask them to do, when they should get their results. While that is happening, we are preparing the testing tube. We put the rec in the bag. We inform Justin that a patient is ready. Justin gloves up. He then walks up to the car, goes down their window. He asks them to lower their mask. The test is executed. That's the complete process from start to end. Typically takes about 4 minutes.
It's been really remarkable to see how Heartland staff have been able to shift from something that we know how to do, which is work with students in schools, to creating and running these really successful drive-thrus, which we feel like is a real benefit to our Heartland population. And we also keep our family, our Heartland family, inside safe by doing all this outside.
Devon was the only testing site for a very long time. Now we actually have 3. We have one at Skokie, and we have one at Albany Park and one here.
We're happy to swab anybody. At the beginning, the process was much more complicated. It was more invasive with a longer swab. And now it's much simpler. It's just a very gentle nasal swab. So people are a little bit nervous. We do our best to try to help them feel more comfortable. And it's a very quick process, in and out in just a few minutes. One thing I'd like to add is just how proud I am of all the Heartland staff. We had these teams come together. Nobody put up a fuss. Everybody was just super eager and helpful. I've had a lot of Heartland staff reach out and offer to help, to volunteer at community events. I think it's brought us closer together, even though we're supposed to be staying further apart. But in spirit, I think it's brought the Heartland crew closer together, and I'm really proud to be a part of the Heartland family.
Hi folks, and welcome back. We are all proud of how the staff at Heartland has stepped up during the pandemic. And Emily's right. Though we are remaining socially distant, it is bringing us closer together. Before we go any further, let's not forget we are at a gala and we are celebrating. So to help put us in the right frame of mind is our friend Jonathan Rodriguez, aka Spicy Boy, with a recipe for a compassionate cocktail.
Hey everyone, and welcome to Heartland Health Center's Socially Distant, Closer Together 2020 Virtual Gala. We really hope you're enjoying yourself, but to make sure that you do, I'm going to show you how to make this year's compassionate cocktail. Now what you're going to need is a set of cocktail shakers, a cocktail strainer, a jigger, lemon juice, honey, and bourbon. Now I'm using Wild Turkey 101, but feel free to use whatever bourbon you have at home. If you have gin or vodka, that also makes a delicious drink, no problem. Now, take your cocktail shaker and your jigger and pour 2 ounces of bourbon. Typically the larger side of a jigger is 2 ounces, but if you don't have a jigger at home, feel free to use a shot glass. They're about 1.5 ounces, so feel free to just pour a little more. A little more has never hurt anyone. Now, take your lemon juice, 3/4 ounces, that's half a shot glass for y'all at home without a jigger. Your honey, full ounce of honey. Honey's a little viscous, so make sure you knock it all out into the cocktail shaker. Every last drop. Cool. Now, take ice, and shake the cocktail. You want to shake the cocktail really hard. Make sure that you incorporate all that honey into the drink. Otherwise, it'll just be all lemon juice and bourbon. All right, take a glass, strain the drink out. Make sure you strain the drink before you add ice. That way not to dilute the cocktail any more than it is. Add ice. And finally, take a big sip, sit back, enjoy the rest of the gala, and please don't forget to donate. Cheers, y'all.
Thanks, Jonathan. I have my compassionate cocktail right here. Delicious. Here's to all of you joining us tonight. Now that we have our cocktails or beverage of choice, let's enjoy the rest of the program. And don't forget to donate. Along with drive-through testing, Heartland Health Centers formed mobile testing teams to go into communities all over the North Side and Skokie to test anyone free of charge. Let's take a look at one of those events.
We partner with community-based organizations that are in contact with people who are most vulnerable and most underserved. So for instance, we are working with Centro Romero, which is in Edgewater, Rogers Park. We also partner with older people from different wards and other community organizations that have helped us, again, be that link or that bridge between the community and our clinics.
Thank you, Heartland Health Centers, for providing the free testing today.
Thank you, Heartland.
We've been partnering up with Heartland Health Centers since the beginning of the construction at the Devon Clinic. And one of the things that we were supporting Heartland to create a clinic there, and also in Rogers Park, the one on Tui, it's because there is a lot of need in our community, especially our immigrant and Latino community, to have access to healthcare. And I know that Heartland Health Centers offered a quality and comprehensive healthcare system.
Thank you, Heartland, for everything right now. This means a lot. Thank you, Heartland.
Definitely feel essential, and just feels great to be able to help out the community, and just to see how many people are so appreciative of what we do. We definitely feel that, especially with everything going on with the pandemic.
The fact that we're out here helping low-income communities, it makes a difference. It just feels great to be able to help. It's been stressful,
yeah,
but we're glad we could help out,
yeah,
and change one life at a time.
Thank you, Heartland, for being here today. I'm so grateful.
Thanks, Heartland, for being here and providing a great service for the community. We appreciate you. Thank you very much.
These mobile testing teams are so critical for our communities. To date, Heartland has provided over 1,000 free tests, including nearly 200 this morning at an event with the Guatemalan consulate on North Elston. You heard many people thank Heartland Health Centers for coming out and providing free testing to the community, but there were also many community partners who wanted to say thank you.
First, I want to congratulate the Heartland Health Centers for all the great work they've done in the past and have been doing during COVID-19. I also want to congratulate all of you who are the supporters of this wonderful organization. Without you, many of the people in our community would not have been healthy and would not have survived all the crises we're going through. I look forward to working with Heartland in the future, and I look forward to next year being able to celebrate with you in person. Congratulations and thank you.
We really appreciate all the work and the effort, and as I've been working with you guys in this COVID testing event, I see that you guys are very passionate about the work that you guys are doing. So thank you so much.
Hi, this is Alderwoman Maria Haddon of the 49th Ward. I want to give a special thank you to Heartland Health Centers for all of your support for the residents of the 49th Ward throughout this COVID-19 pandemic. You have been wonderfully responsive to the needs of our residents. Special thank you to Dahlia for working so hard and coordinating mobile testing sites with my team to make sure that we were able to reach as many residents as possible. During these difficult times, you've been a wonderful friend and resource in the community. Your support is saving lives. Thank you so much.
I want to say thank you to Heartland Health Center for their support and our partnership with doing the COVID testing in our community. Thank you. Quiero dar las gracias a Heartland Health Center por estar con nosotros haciendo los exámenes de COVID. Gracias.
I'm here in the ward partnering up with Heartland Health for a COVID testing site, and I really appreciate the commitment, the strength of having community partners like Heartland Health, and so it really warms my heart and helps me feel safe because this is where I'm getting tested for the first time too. So Heartland Health, thank you all so much.
Today, I want to thank Heartland Health Centers for the great job that they have been doing for our immigrant community, but especially for the Guatemalans. We have referred a lot of cases of Guatemalan people that have been able to do a COVID-19 test free. Thank you for this great job during this pandemic, and we hope to keep working together in order to help our community from Guatemala. Thank you very much and God bless you. El día de hoy quiero agradecer el invaluable apoyo de los centros de salud Heartland durante esta pandemia. Hemos referido a cientos de guatemaltecos que no cuentan con un seguro médico en este país para poderse realizar una prueba del COVID-19. También Hemos trabajado a lo largo de estos años educando a nuestra comunidad en temas de salud preventiva con ustedes. Sigan adelante y bendiciones.
Today I'm participating in a community testing event hosted by Heartland Health and Centro Romero. We are very happy to participate and be part of this great cause. Thank you, Heartland.
Thank you, Heartland Health Center!
Hi, and welcome back. We are so excited and truly honored to welcome our first entertainer of the evening. This is going to be awesome. Chicago's own Jeff Tweedy of Wilco.
Hi, this is Jeff Tweedy, and I have many reservations, but none whatsoever, about the Heartland Health Centers and the work that they do. Congratulations on your virtual gala, and please enjoy my performance.
How can I convince you it's me I don't like? Not be so indifferent to the look in your eyes, when I've always been distant and I've always told lies for love. I'm bound by these choices so hard to make, bound by these feelings so easy to fake. None of this is real enough to take me from you. Oh, I've got reservations. There's so many things, but not about you. This isn't what you were wanting me to say. How can I get closer and be further away from the truth that proves it's beautiful to lie? Oh, I've got reservations. That's so many things, but not about you. Oh, I've reservations. That's so many things, but not about you. It's not about you. It's not about you. It's not about you. It's not about you.
Wow, that was beautiful. Thank you, Jeff Tweedy. All you Wilco fans have probably already noticed this, but there is an incredible Wilco package as part of the silent auction tonight. Make sure you get your bid in, and remember to visit the silent auction going on right now. There are tons of amazing items, so you don't want to miss out. Now, we want to spend a few minutes showing you how the staff at Heartland Health Centers has pivoted to provide telehealth access for patients from scratch when the stay-at-home order was implemented. First, you will hear from two key staff members, Val Zaldivar and Stephanie Blagajec, who were critical architects of this system. Then you'll hear and see how the advent of telehealth supported patients not only with primary care needs, but through the isolation and anxiety that many of us have experienced in the last few months. Take a look.
March 16th was kind of a very scary day. I think what a lot of the things that were going through our mind was like, how are we going to make it through this? And by that, I just mean like, how are we going to see patients? How are we going to be able to provide care? And the most urgent issue is like, how do we do it quickly? Because we can't see any patients. Patients can't come in to the clinic at all.
The decisions that were made quickly, I think, were great decisions and led us to provide care to patients that ultimately, I think this is, as cliche as this sounds, the future of healthcare.
I think it was like 2 or 3 business days. We were up and running with phone services. By Thursday of that same week, we were up and running with video visits. Also by end of the week in one clinic, and then testing it out at different sites the following week. So really the speed at which it had to be done cannot be understated.
When schools were closed, we wanted to make sure that we distinguished that Heartland Health Centers is not, that we are not closed. We are still here, accessible and available to provide high quality care to our students. Telehealth, just as it has impacted so many of our community patients, is also something that we're opening up as an opportunity for our students.
So now looking forward, we're really trying to adapt and make sure we meet the patient where they are. And a lot of it is just doing as much as we can through text messaging and through communication means that aren't increasing barriers to care.
We are giving the patients what they want in a way. If I need to get a refill on medication, I don't have to worry about whether or not I'm able to get to the clinic, whether or not, transportation is an issue or childcare is an issue. Right? I can get that refill from the comfort of my own home.
Without the team, the whole telehealth team, which is every major department representation of Heartland Health Centers, without being able to coalesce so quickly, so rapidly, and really so driven to the mission of providing care to underserved patients, to populations that really need care and really depend on us, I don't think we would have been able to accomplish what we did.
I think there are so many social determinants of health that affect our patient population in ways that we might not always be aware of. And the fact that we're removing some of those barriers by allowing patients to receive care from the comfort of their own home, I think is huge and something that I will always be proud of. I think we've opened up so many doors in patient access through telehealth that will live far beyond COVID. And I'm excited to see the future of what patient access looks like and how we can better meet the needs of the patients.
People really need access to care now more than ever, and not just access to any type of care. People need access to the most affordable type of care. And being an FQHC and being able to marry that with telehealth, to me seems like a match made in heaven. I couldn't think of an organization that would benefit and could benefit more people than Heartland Health Centers with telehealth during a pandemic.
When I went to Heartland, I found some very, very caring givers. Dr. Panzer is a gifted healer, and he had referred me to Dr. Sonia Oyola, whose practice in integrative medicine is right in line with the way I feel about it.
We assess the mind, body, and spiritual health of a patient and are able to integrate or combine evidence-based conventional medicine with evidence-based complementary medicine. The idea is to form very specific, unique plans that will help a patient achieve their goals.
She took the time to talk with me. I think our first meeting was a good solid 45 minutes, just checking into what I was doing, what works for me, what we'd like to try. So she supported my decisions to not immediately jump to medication, not immediately jump into, well, just give me a pill and fix this. We were looking at an integrative, a complete support system, a complete system. Mind, body, spirit, that's how we heal.
I called Dr. Shah and got involved with integrative health. He considers me as a whole person, my emotions, my just general well-being, any mental health struggles. He considers different things that I don't talk about with Dr. Panzer, like supplements and vitamins and exercise levels. So it's really about me as a whole person. So I feel really well taken care of because I feel like I have a team, and so I do feel like it's the best of both worlds.
I think a telehealth visit available to me is a great option.
When they told me that I could do telehealth, I was really excited. It's enabled me to be able to go to the doctor without having to physically go to the doctor. And some days that can be pretty hard. With a chronic health condition, you never know what each day is going to bring. So when you make an appointment and the appointment comes and you're not feeling well that day, it's really hard to get there and do what you need to do. So it's been great to be able to do telehealth and talk to my doctors, check in, do everything that needs to be done over the phone.
My telehealth visit was very effective. I felt like Dr. Sonia was connecting with me. She was able to listen. Plus she was able to see where I lived. Like she saw me in my element, so I felt very comfortable. I think the telehealth sessions were very time efficient, and I think the telehealth sessions are a great option because, man, I remember being so sick I couldn't leave the house. So this is a very good option. Telehealth needs to be the movement forward. God, you know, why haven't we done this sooner? Not putting the doctors at risk, not putting the patients at risk.
I think telemedicine, first of all, is here and it's here to stay. I think that the service, the work that Heartland shares with the community has become broader. I think it has become more expansive. It is now reaching patients that would have never been able to physically come into the office.
To be grateful for Heartland is just an understatement.
I'm in a much better place now because of Heartland Health.
The driver of starting these groups was loneliness and the idea that, you know, we live in a society where everything is individualized, our care is individualized, we take care of ourselves, but that's not how humans work so much of the time.
There's research that's been shown that loneliness is linked to not just mental illness or mental health conditions, but also other chronic illnesses.
We need community, we need support, we need more than a 10 or 15 minute visit with our doctor every once in a while to really get that care and practice healing and wellness and to really thrive, I think, as human beings. And so much of the time it's just, we're just alone and left to do everything by ourselves.
I joined this group to help me lose weight. But what I learned from the group is that it's a lot more than just losing weight. You gotta love yourself, you gotta take care of yourself, put yourself first. So those are the things that kind of helped me understand, okay, so this is what I have to do to feel good about myself, and then I can lose the weight.
I was going through a very, very bad phase where I was in a lot of pain.
I am here because I want to manage my diet.
I always had an unhealthy relationship with food, and I have physical problems, so I thought this would be a good way to, you know, maybe hear other people's stories, what they were going through, and, you know, and just learn more about what I could do for my own situation.
One of the things that that has helped me a lot is being able to ask a question in the group.
You come in, you can ask questions. We have the doctor and we have our nutritionist, both of them are here. So yeah, you get to ask these questions and they answer it to the best that they can, and it's really cool.
And the different topics are really good. And I also really like the incorporating the yoga.
We're able to make changes in our life, positive changes that we want to make when we feel seen and heard, and when we can see our experiences reflected in other people. That's something that's best done in community.
Having a community of people here that are going through similar things and we all get together and just talk, it's just really good. It feels good to do that.
For me, it was like therapy. There was a way for me to get support.
Just to talk with other people and not be judged, it feels like a safe place for me. You know, so it's like a shot in the arm every week. I really appreciate having this.
This is a way that we can transform healthcare to be not so individualized and really provide support, whether it's medical support from providers, but also just community support from each other and sharing stories with each other.
What are some common traits or issues or complaints that most patients or participants have during the COVID relief?
So when we first began the group, Pimba and Miss Jones, they actually were doing great. We ended up forming a friendship, essentially. And the purpose of the group was just to provide a safe and open space to speak about, again, everything that's going on in the world right now, or anything else that they would like to share, and just to connect with one another and have that support.
Right, and I would also add that the initial focus was about anxiety around COVID-19. But if you have anxiety around COVID-19, it's not just COVID-19, because it doesn't exist in a vacuum. It's all the other factors, the media, the behaviors of government officials related to the virus, related to protections from the virus. None of this happens in a vacuum. So it's really just a safe space to talk about everything that's going on.
What type of connection are you guys making in this group, if I may ask?
Supportive, women power, supportive, can have different views but still be respected. That's not normal nowadays.
I would also add that it's a room full of equals. Nobody's trying to be the star. Nobody's trying to dominate. We're all just sharing where we are at the present time.
I feel a sense of connection, and I don't always.
It's just very relieving to come and join this group and speak with the ladies for an hour and just to connect and get that support, because I feel like these past few months, we all had to undergo a lot of changes. So this is just a phase for me as well, although I'm doing my job.
Thank you so much for sharing. If you guys have any last thoughts of what you want to say.
Working at Heartland has been one of the most amazing professional experiences that I've had, because everybody there is there intentionally. They're not there to further their own agenda. They're there to serve the community. Please give to Heartland. It's amazing.
I am very grateful for Heartland and the connections they have.
I say support Heartland. If you're here at the virtual gala, give and give deeply.
Seeing the different ways telehealth is helping our patients and changing the way we practice medicine is truly powerful stuff. I mentioned earlier this evening that Heartland Health Centers has clinics in 7 Chicago public schools, giving students access to full primary, behavioral, and dental care right in the comfort of their own school. When CPS went completely remote in March, staff continued to support their student patients with telehealth and phone calls. We have 2 students tonight from Sen High School who can share how having a school-based health center supported their well-being and mental health even during the shutdown. I think you're really going to enjoy this.
Hello guys, my name is Naima Woods.
And my name is Marcus Fields.
And today we will be giving you the student perspective of how we dealt with Heartland Health Clinics at Sen High School. I think it was very important to have a health clinic on campus because it teaches you about self-responsibility. You know, while having school going on and everything, I was holding myself accountable for getting my shots and making sure I was doing my checkups.
They made me feel so welcomed and so comfortable. So if there was something I needed or something I was unsure about, I would go straight to them regarding like my health, my mental health, my physical health, anything. And they would like give me the best advice.
It was very convenient to have these people downstairs, and whenever we needed something or to schedule something or sports physical, anything of that matter, they were immediately just right there and open during school hours.
It was always, if like I was feeling down about something, I'd always schedule an appointment with like the therapist, or like I would like just go down there for like during my lunch if I needed some advice.
They were super reliable and super welcoming that it just made you feel like you belong there. And we did belong there because we needed the treatment, we needed the help.
When I first became vegetarian, I had no idea about any type of vitamin. It came to a point where I developed a vitamin 3D deficiency. I thought it was a mental illness. I had like no energy, just like all the symptoms. I instantly went to the clinic one day and I was like, what's wrong with me? And yeah, they did all the blood tests or whatever. And they're like, you kind of low on vitamin 3. And I was like, okay. And so, yeah, they just helped me with that. Now I'm back to my normal self. Like, I feel like alive as ever. I feel great.
I know Heartland staff has reached out to numerous students and patients across their clinics and have reached out with the telehealth.
So did you have any telehealth appointments during like your COVID quarantine?
Actually, I did. I actually had telehealth with Ara. It was amazing because it felt like I was back in her office on her comfortable couch in the best setting and just having a conversation. It made the most unnormal times feel normal.
The clinic has made me more self-aware because I was actually a part of the clinic's nutrition club.
It's a nutritionist, right?
Yes, her tools and like her techniques and her tactics like were like top tier. Like I felt, to be honest, my high school years were definitely my healthiest years because of her.
Those people made me, my 4 years of being in high school, they have made me the person I am. They have made me a strong woman. They, you know, when I was upset and I go, you know, to their office crying or something, they would rebuild you and just work with you. They wouldn't judge you. And that was probably the best things about that clinic. Well, thank you guys for tuning into our interview. I'm Naima Woods.
And I'm Marcus.
And we hope you guys enjoy the rest of the gala. Goodbye.
Bye.
Now to introduce tonight's honorees, I'd like to bring back Interim CEO, Nicole Willis.
Good evening again. It's my pleasure to introduce our first honoree of the evening, Candace Wendell, a surgical nurse from Amita St. Francis Hospital in Evanston. Tonight, we honor Candace with the COVID-19 Extraordinary Service from the Heart Award for being on the front line with her team at Amita Health St. Francis. And in doing so, we recognize the incredible challenges that the pandemic has placed on doctors, nurses, medical personnel, and all frontline workers.
Good evening. My name is Candace Wendell, and I am honored to accept this extraordinary service award from Heartland Health Centers. As a surgical nurse at Amita Health St. Francis Hospital in Evanston, there are always challenges, but none like what we have seen with the COVID-19 outbreak. Doctors, nurses, all medical personnel, and all frontline workers have literally put their lives on the line to help others. I am very grateful for this recognition, but I also want to give a shout out to my team at St. Francis. I share this honor with you tonight. Congratulations to Heartland Health Centers on your virtual From the Heart Gala. Thank you again for this incredible honor and for all the important work you do. Thank you.
Thank you, Candace, and your entire team for all that you do. Now it is my pleasure to introduce Doug King. In April of 2020, Doug was principal in charge for the design team of Stantec Architecture, Inc. in Chicago for the development of the 3,000-bed McCormick Place alternative care facility that was designed and constructed for acute care COVID-19 patients. This project was designed and constructed in a period of just 25 days to beat the projected COVID-19 patient curve in Illinois. Doug, tonight we honor you for your skill and perseverance and present you with this COVID-19 Innovation in Architecture from the Heart Award.
I'm honored today to be here for the award that was given to myself and our team for the innovative design work done at the McCormick Place Alternative Care Center. We have to recognize and acknowledge that a project such as McCormick Place takes in the work of hundreds of people. From the first day, the attitude of our team was that of a mission. This was a mission that we couldn't fail. Innovation in design for COVID-19 occurs because of the collegial efforts of many people and the combination of talents that come into play to create such a facility. We need to recognize the 3 former and current hospital CEOs in Chicagoland who helped develop the administrative portion of this project. They are Dr. Nick Turkle, Martin Judd, and Paul Merrick. Of particular note, we need to recognize the Central DuPage Hospital, Northwestern Medicine, and Rush University Medical Center for their contributions to the operations of this facility. The contractor on this particular project is Walsh Construction, led by the enthusiastic Tom Kaplis and his colleagues Jim Reichert and Lieutenant Colonel Eric Green. Together, they administered and ran a team of subcontractors around the clock. Supporting their construction efforts was myself serving as the technical advisor on the project and a talented team of architects from Stantec Architecture. Also critical to the success of this complicated project is the MEP Engineers Environmental Systems Design, led by a very talented engineer, Randy Errett, and the structural engineers, Thornton Tomasetti, led by Kevin Jackson. I hope my teammates are listening tonight. You definitely represented the highest form of teamwork and team effort that one could imagine. And most importantly, we need to thank Heartland Health Centers. They have an ongoing and urgent mission to serve and provide quality health care to individuals who need it most and can afford it the least. This critical mission requires significant resources and contribution from our community. I ask each of you to consider Heartland Health Center's challenges as you make donations tonight. This Innovation in Architecture Award for the design of the McCormick Place Alternative Care Center for COVID-19 is a huge honor. And on behalf of our team, I humbly accept it and want to thank Heartland Health Centers for this consideration.
Thank you, Doug, for those kind words and for your incredible work completed under immense pressure. Lastly, it is my extreme honor to recognize Dr. Ngozi Ezike, Director of the Illinois Department of Public Health. Dr. Ezike is a board-certified internist and pediatrician who joined the Illinois Department of Public Health from Cook County Health, where she had served for more than 15 years promoting the organization's mission of delivering integrated health services with dignity and respect, regardless of a patient's ability to pay. In her role as director of IDPH, Dr. Ezike found herself front and center during the onset of COVID-19. Every day, Dr. Ezike joined Governor Pritzker and others to help us understand the threat of this disease and how to keep ourselves, our loved ones, and our communities safe. Amid the chaos of those early days, Dr. Ezike's daily message was often harrowing, as the numbers of infections and deaths mounted, but was also filled with compassion and anchored in science. Dr. Ezike provided clear, fact-based information and then flawlessly translated her remarks into Spanish. Dr. Ezike, it is my great privilege to honor you tonight with our COVID-19 Voice of Reason from the Heart Award.
Good evening and congratulations to Heartland Health Centers on the occasion of your 5th annual From the Heart Gala. It is my humble honor to accept this Voice of Reason award. The Illinois Department of Public Health prides itself on providing scientifically based data, resources, and guidance to every person and every community across Illinois. HHC is a valued partner in the work that IDPH is undertaking. In these challenging times, public health plays a critical role, and I'm thankful for Team IDPH as they continue the statewide response to this global pandemic. No one has been spared from the effects of COVID-19. We all must continue to educate everyone on the severity of this deadly virus and the preventive measures that work to help stop its spread. FQHCs have a critical role in curbing the spread of COVID-19. Heartland Health Centers pivoted quickly to provide telehealth visits for patients and implement drive-through testing at 3 of its clinics. Most impressively, HHC staff has tested hundreds of people at no cost through their mobile community testing sites. These are vital services which play a significant role in fighting this global pandemic. Remember the 3 W's. Wear a face covering, wash your hands, and watch your distance. Thank you again for this honor, and thank you for the important work that you do.
Thank you, Dr. Ezike, and thank you to all of our honorees for your leadership, creativity, and strength. Your contributions during this extraordinary time have made deep and wide impacts, and we are grateful for your service. Enjoy the rest of our program, everyone.
Good evening, and thank you for joining us tonight. My name is Matt Katzby, and I'm a governing board member and the development board chair for Heartland Health Centers. I'm also the proud father of 2 singers in Chicago Children's Choir's Albany Park Neighborhood Choir, Eden and Elizabeth. Today, I am thrilled to bring these 2 wonderful organizations together.
Chicago Children's Choir is a nonprofit organization that inspires and changes lives by uniting youth from diverse backgrounds through the power of music to create global citizens. Founded in Hyde Park in 1956, the choir's inception was a direct response to the civil rights movement. Since that time, Chicago Children's Choirs have grown from one choir to a vast network of in-school and after-school programs, serving over 5,000 young people across the city of Chicago.
The performance you are about to watch features singers from Chicago Children's Choir and school, neighborhood, and Voice of Chicago programs, performing Our World. This original song was written by Chicago Children's Choir conductor Lonnie Norwood and expresses a hope for a more peaceful world.
Thank you and enjoy.
Let's all get on one accord to help the least among us. The needs are mine and yours. Drop your guns, study war no more. Take the pledge for peace like never before. There are many, many places and so many, many faces. It's a canvas, a collection of beauty and perfection. This is our world. This is our world, in the cry of every nation. This is our world. This is our world, in the cry of every nation. Loose the grip of imprisonment. Freedom's peaceful soul. Watch your garden grow. Don't live life thinking colorblind. See me with your eyes and intentional design. There are many, many places and so many, many faces. It's a canvas, a collection of beauty and perfection. This is our world. This is our world, in the cry of every nation. This is our world. This is our world, in the cry of every nation.
While I rock the beat, I'ma rock for peace. From the Chi-Town streets into the Middle East. Fight government cutback, civilian setback. I want to come back, but we won't turn back. From breaking the bonds in the side of the mind. We're at the universal scribe, better notice mankind with a dream keepers, the good life seekers, generation believers. All our free world leaders, stand up.
Many, many places and so many, many faces. It's a canvas, a collection of beauty and perfection. This is our world. This is our world, in the cry of every nation. This is our world. This is our world, in the cry of every nation.
What a beautiful song and message. Thanks to the Chicago Children's Choir for that uplifting performance. At Heartland Health Centers, the majority of our board of directors is made up of consumer members, our patients. These members provide critical insight into our services and our quality of care. In the last year, we lost two longtime consumer board members, Pat Parsons and Doris Gray. Join me in paying tribute to their contributions to HHC and their legacy.
Doris Gray and Pat Parsons really created a legacy for the organization in terms of what to expect of consumer board members, that they really invest their time and energy in a way that comes from the heart.
Doris was a consumer member, which means she actually utilized the services of the health centers, which was terrific because she brought a very unique perspective of the quality of the service, the quality of the providers, the general quality of care, the overall condition of the facilities, everything about it.
Doris really, gave so much of her personal time. She was on the board for 15 years and was the board secretary for many, many of those years.
She set an example as a board member and what it was to be committed.
My mother wrote notes on everything, finances, ideas, upcoming events, what she could add. I found so much of Heartland in her things.
As we grew the organization over the years and we looked at how do we best align with patient needs, Doris had a very strong voice and a very strong hand in helping to guide that sort of development of the organization to be the robust, patient-centric organization it is today.
It was very clear from the get-go that she was just very engaged, very committed, very passionate about the health centers.
It was really important for her to make sure that the health care was, available to everyone, whether or not they could pay for it.
It was definitely an honor for me to know Doris and to work with her, and I did learn quite a great deal from her, and I was also inspired by her. I mean, I'm hoping that when I get to be the age she was when I knew her, that I can still have that much passion and that much energy and that much joy and care so deeply about something and be committed and still be very active in my community.
There's no way that I think of my mother and not think of Heartland. The awards and the time spent, the relationships developed through my mother being a part of this organization. And this organization supported me through my mother passing, just like they supported me through Pat passing.
I first met Pat when she came to our TUI office, and she was a patient, and I quickly recognized how brilliant she was. She was a CPA. I thought she'd be perfect for the board, bringing in that information, but also because she understood what Heartland was all about. She was able to express to me as a patient just how thankful she was for the care that we provided, what a high quality of care we had, and I could tell she was looking at the little details. Pat was a real firecracker. She was never afraid to speak her mind and stand up for what she thought was right. Pat's point of view was so valuable to us. With her financial background, she could help to keep us sustainable, but also delivering the high quality of care that she herself felt like she received at Heartland. Shortly after Pat joined the board, she became close friends with Doris.
And it was just really inspirational to see them bond with each other and give their time and energy to the organization, and then also to see them be there for each other when they needed it.
Between Pat's financial background and Doris being the consummate consumer board member, they were a force to be reckoned with. That dynamic duo has driven us to do better, be stronger, and provide a higher level of quality of care.
As mentioned earlier, this year our fearless leader, Gwen Rausch, retired after 10 years of service. I could say many things about Gwen and all the ways she steered Heartland Health Centers through rough and smooth waters, but let's take a minute to hear from two people who worked with Gwen closely during her entire tenure, Board Chair Philip Dothard and Heartland's Chief Medical Officer, Dr. Lori Carrier.
When Gwen joined Heartland in April of 2010, there were only 4 health centers, a handful of providers, 30 staff, and a few thousand patients. 10 years later, we have 17 sites, 50 providers, over 200 staff, and 28,000 patients. We have also had expansion of our patient base, clinical services, community partnerships, schools, neighborhoods, and specialties. Gwen has led Heartland in providing essential health services to vulnerable and diverse populations.
With Gwen's leadership over the past decade, we have cultivated a system that works for our patients, families, and communities. Our work has been recognized with awards and accreditations, but most importantly, she has built a team of leaders around her at the board and staff levels to carry on Heartland Health Center's mission.
Gwen, you have been an excellent boss, an amazing mentor, a sounding board, and a voice of reason. As a truly patient-centric advocate, you are always thinking about who we're serving and why and how we can serve them better. I am profoundly grateful for what you have left behind. A strong and successful organization, an extremely talented team on the front lines, the next generation of leadership, and a lasting legacy of kindness and inclusiveness. Gwen, thank you for an amazing 10 years.
Thank you, Gwen, for your service. Here's to a happy and well-deserved retirement. Before we close out the event, I wanted to remind everyone that even though we can't be together this evening in person, we're all here united in support of Heartland Health Center's mission to ensure access to high-quality health care on the north side, northern suburbs, and beyond. The From the Heart Gala is Heartland Health Center's biggest fundraising effort of the year. Every dollar donated will go directly to providing critical healthcare services for those most in need. Whether you outbid your friend on a silent auction item, take a chance on winning a few thousand in the 50-50 raffle, or simply make a donation in any amount you can spare, please do what you can so that Heartland Health Centers remain strong and ready for what is to come. Many people have been working diligently to put this program together tonight, particularly the members of the Virtual Gala Host Committee. They've contributed time, energy, money, and talent to ensure this event's success. Let's hear from some of them about the many ways your donations directly impact healthcare access for all.
Thank you for joining us tonight and for your generosity.
We could not do it
without you. All money raised helped pay for PPE
and telehealth costs,
plus drive-through testing
and community testing events.
And well-child
visits and school-based health centers.
And behavioral health,
wellness classes,
integrated holistic care for patients.
And interpretation services for immigrant and refugee patients.
And comprehensive primary and
dental care. We could not do it without you. Thank you.
Thank you so much, everyone, for joining us tonight and supporting the work of Heartland Health Centers. You still have 30 minutes to make any last-minute donations or silent auction bids as we move to our after party. To kick things off, here's Heartland's own Spirit video created in the early days of the shutdown. Then stay tuned for our dance party with DJ Gak. Thanks, everybody, and have a great night.